Have you ever wondered how much a single curve on your face can alter the world's perception of beauty? Throughout history, beauty has been a canvas of continuous transformation, reflecting the ever-changing ideals that societies cherish. In this pursuit of aesthetic perfection, the nose, perched right at the center of the face, plays a pivotal role. It's not just a feature, it's a statement, influencing how harmony and proportion are perceived across different cultures and epochs. Enter the world of cosmetic enhancements, where nose lift surgery, also known as rhinoplasty, emerges as a beacon of transformation. This procedure isn't merely about achieving a more pleasing nose shape. It's about aligning one's external appearance with their inner self-esteem and the broader societal definitions of beauty. It's about the confidence that comes from the reflection in the mirror, aligning with one's vision of self. Nose lift surgery stands at the intersection of art and medical science. It combines surgical precision with the aesthetic judgment of a sculptor, each procedure tailored to the unique contours and dimensions of an individual's face. The goal? To enhance facial harmony and, by extension, bolster personal confidence. As we explore this fascinating procedure, we'll uncover not just the technicalities, but also the profound impact it has on individuals who choose this path. It's more than a surgical procedure. It's a journey towards self-improvement. Let's delve deeper into what a nose lift really entails and why it's more than just a change in appearance. Nose lift surgery, or rhinoplasty, might sound straightforward, but it's a marvel of modern cosmetic science. This procedure, deeply rooted in both aesthetic and reconstructive techniques, reshapes the nose to improve appearance and function. But what exactly does this involve, and how do the various techniques cater to different needs? At its core, a nose lift involves modifying the bone, cartilage, and soft tissues of the nose. This can be done for several reasons: to alter the size, change the shape, correct congenital or injury-related defects, or improve breathing. Each procedure is as unique as the individual undergoing it. Let's delve deeper into the types of rhinoplasty. The first type is reduction rhinoplasty, designed to decrease the overall size of the nose. This involves removing bone or cartilage to achieve a more proportional look. It's particularly beneficial for those who feel their nose dominates their facial features. On the flip side, we have augmentation rhinoplasty, which aims to increase the dimensions of the nose. This might involve using grafts from the patient's own body, typically from the ear or rib, to build up the nasal structure. This method is often chosen by individuals looking to restore balance or correct depressions on the nose's surface. Then there's post-traumatic rhinoplasty, which repairs the nose after injury. This can be crucial not only for cosmetic reasons, but also to restore functionality, such as fixing a deviated septum that impairs breathing. Refinement rhinoplasty focuses on the definition and contours of the nose, particularly the nasal tip. This procedure is often sought by those wanting subtle changes that enhance the nose's aesthetics without altering its character dramatically. Lastly, reconstructive rhinoplasty is used to treat severe deformities or after significant tissue loss. This complex procedure may involve multiple stages and various grafting techniques to achieve a functional and aesthetically pleasing outcome. With each technique tailored to individual needs, understanding the procedure is key to setting the right expectations. Whether seeking to correct a functional impairment or simply enhance facial harmony, a nose lift can be a transformative journey. Imagine you've decided on a nose lift. What happens before the surgery? The journey to a refined nasal profile starts long before you step into the operating room. It begins with an essential phase: preparation and consultation. First, choosing the right surgeon is paramount. It's not just about skill, it's about finding a surgeon whose vision aligns with your aesthetic goals. A reputable surgeon will have a portfolio of before and after photos, credentials from accredited medical institutions, and positive patient testimonials. This choice will significantly influence the outcome of your surgery. Once you've selected your surgeon, the next pivotal step is the consultation. This isn't merely a discussion, it's a comprehensive evaluation. Your surgeon will assess your nasal structure, skin quality, and overall facial balance. But it goes beyond the physical aspects. They will inquire about your medical history, current medications, and any allergies. This information is crucial to tailor the procedure to your specific needs and to mitigate any potential risks. Preparation also involves a series of pre-operative instructions. You might be advised to stop taking certain medications that could increase bleeding, such as aspirin or ibuprofen, and to quit smoking several weeks before the surgery to enhance healing. Mentally preparing is equally important. Understanding the realistic outcomes and the patience required during the recovery phase can help set the right expectations. Preparation doesn't just ease the process, it ensures safety and aligns outcomes with expectations. The day has arrived. What actually happens during a nose lift surgery? Imagine stepping into a serene, well-equipped operating room. The air is filled with a sense of precision and calm anticipation. The first step in the journey of transformation is anesthesia. For most nose lift surgeries, you'll be under general anesthesia, which means you'll be asleep and won't feel a thing during the procedure. An anesthesiologist will be there to ensure you're comfortably sedated and monitor your vital signs throughout. Once the anesthesia has taken effect, the surgeon begins the actual surgery. The type of nose lift you're undergoing will dictate the specific techniques used. Typically, the surgeon makes incisions either inside the nostrils or across the columella. That's the little strip of tissue separating the nostrils. This strategic placement keeps any scars well hidden. With the incisions made, the surgeon reshapes the underlying bone and cartilage. This could mean removing some cartilage to reduce size, reshaping it to alter the nose's profile, or even adding cartilage grafts, often taken from the septum or ear, to enhance certain areas. The goal is a more balanced and harmonious nose that complements your facial features. Throughout this process, cutting-edge tools and technologies are at the surgeon's disposal. High-definition cameras and specialized surgical instruments allow for precise modifications with minimal invasiveness. This technology not only improves accuracy, but also reduces recovery time. After the modifications are complete, the surgeon carefully redrapes the skin over your newly shaped nose and closes the incisions with sutures. In some cases, a temporary splint is placed on the nose to support and protect the new structure during the initial healing process. As you gently wake from anesthesia, the procedure is likely done. You might feel groggy or a bit disoriented at first, a normal side effect of anesthesia. But there it is. The first step in your journey to a new look is complete. While the procedure might last only a few hours, the journey to your new look is just beginning. After the final stitch is in place, the journey to recovery begins. The road to unveiling a new profile starts right after surgery, with the initial phase being crucial for healing. Swelling and bruising around the nose and eyes are common and tend to peak within the first week. It's not just about aesthetics. This is your body's natural response to the surgical procedure. During this time, it's imperative to follow your surgeon's aftercare instructions to the letter. These may include elevating the head while sleeping to reduce swelling, avoiding strenuous activities, and steering clear of any potential facial impacts. Ice packs can be gently applied to minimize swelling, but always with a cloth barrier to protect the sensitive skin. Pain, though generally mild to moderate, is expected. Your healthcare provider will likely prescribe pain management medications. It's important to use these precisely as directed to ensure comfort and avoid any complications. As days turn into weeks, the transformation becomes more apparent. The swelling subsides and the contours of your new nose start to emerge. However, complete healing is a gradual process. It can take up to a full year for all subtle swelling to dissipate and the final shape of your nose to fully stabilize. Remember, every individual heals at their own pace, and the final results depend on several factors, including the complexity of the surgery and your body's unique healing ability. Patience and proper care are your best allies in unveiling the new you. Every surgery carries its promises and perils. When considering a nose lift or rhinoplasty, many are drawn to the aesthetic and functional benefits it offers. At the forefront, this procedure can dramatically enhance facial symmetry and proportion, which often translates into a more pleasing appearance. It's not just about vanity. For many, these changes can lead to significant boosts in self-confidence and self-esteem. Beyond aesthetics, a nose lift can also offer functional improvements. For individuals who have suffered from structural abnormalities or injuries, this surgery can sometimes improve breathing functionality. This isn't just about sleeping better at night. It's about enhancing overall quality of life through improved airflow and respiratory health. However, where there is potential for great reward, there is also risk. Surgical complications, though rare, can occur. These might include adverse reactions to anesthesia, infection, or prolonged swelling and bleeding. It's crucial to have these procedures done by skilled, certified professionals to minimize such risks. Moreover, there's always the possibility of dissatisfaction with the results. Each person's face is unique, and the subjective nature of beauty can mean that outcomes aren't always what one expects, despite the surgeon's skill. Lastly, there are general health risks to consider. Patients with certain medical conditions might face higher risks of complications. Comprehensive pre-surgical evaluations are essential to address these concerns. Armed with knowledge, you can weigh the benefits against the risks to make an informed decision. Now that we've uncovered the layers of nose-lift surgery, the final question remains. Throughout our exploration, we've delved into what nose-lift surgery entails. It's a transformative procedure aimed at refining the shape and profile of the nose, aligning it more closely with one's aesthetic desires. From the careful preparations and consultations to the procedure itself and the recovery process, each step is crucial for achieving the desired outcome. We've also highlighted the potential benefits. These include not only enhanced facial symmetry and improved proportions, but also for some, a boost in self-confidence and satisfaction with their appearance. However, it's equally important to weigh these advantages against the possible risks such as complications, dissatisfaction with results, and the physical effects of surgery. Before making a decision, it's wise to consult with qualified professionals. Evaluate your personal health, motivations, and the potential impact on your life. Beauty is deeply personal, and so is the choice to enhance it. May your decisions reflect your deepest desires for yourself.